The battle rages on, the debate rages on about mask mandates, about vaccine mandates, about shouldn't you be vaccinated, how safe are they? When I was contemplating the vaccine, I reached out to a couple of different people, both of them physicians, one of them my primary care physician, and the other one is Dr. Paul Lynch, who is the founder and CEO of Arizona Pain. We've had Dr. Lynch on the air before. He is someone that left his practice here, went to New York during the initial surge in COVID-19 cases, ended up contracting COVID himself, and has been very well connected to the issue. So when all of this was happening, I wanted to consult people that were well-versed, that were in the medical field, that were physicians, and that I trusted. And he was one of them. He joins us now. Dr. Lynch, let's start with where you are now compared to where you started with COVID-19 and the vaccines. How far have we come, and what's your opinion about the vaccines?
Yeah, thanks a lot for having me on the show today, Mike. So I've thoroughly researched the data on the three available vaccines in the United States today, and I continue to tell my patients, my family, my loved ones, this is the right thing for you to do medically. There was a large review done of 160 million Americans who've been vaccinated, and there was only 1,500 people who died. And I did my own analysis on it. If you would have looked at that same 164 million Americans last year, it would have been between 200,000 and 300,000 people dead. So we can confidently stand here right now as medical professionals and say that this vaccination effort in the United States has probably saved about 250,000 people that would have been dead otherwise. And over the next 12 months, it'll probably save another 500,000, especially if we can get the word out and get more people to get vaccinated.
I saw a video you posted the other day about the way we're fighting about this and demonizing people and the arguing and that it's not doing much good. What approach are you taking with people? Is it just what you did now, giving them the facts, or what is it that you're doing to kind of bridge that gap in the conversation?
Yeah, thanks for that question. I think it's such an important question. You know, Mike, if you allow me to talk about my own personality and who I am, I grew up in a very Christian home. My relationship with God is still very important to me. And I think that as a doctor, when I'm talking to a patient or a friend, I primarily want to make sure they have the facts. I want to make sure that that they understand that this will save their life. But I also have a secondary agenda, Mike, and that's to show them love, to be caring, to be kind, that even if they walk away from me and say, you know what, I'm not going to get vaccinated, I want them to think, you know what, that man showed me love. He listened to me. He was empathetic. So I have a two-step process. Number one is I just start by listening. I don't talk a lot. If someone wants to talk to me about how they haven't been vaccinated and why not, I listen. I try to listen to their words, and I show empathy. And empathy is really trying to understand where they're coming from. Sometimes it's as simple as reflecting back to them what they're saying. I had someone attack me on social media last week, was really upset about what had happened to them personally and how they got sick and family members got sick, and they were really angry at me. And what I did is I reflected back to them. All I said was, it sounds like you had a really hard year. I'm sorry you went through that, and I'm going to be praying for you and your family. And as soon as I did that, it broke down the walls. Instead of attacking me, they said, I just want to let you know I've been following you since the beginning, and I appreciate everything you're doing, and I'm sorry I came off angry. And what it did was, by me being empathetic and listening, it bridged the gap so that we could have a conversation. And so after I listen and I'm empathetic, then I'll start to give some data if the person's open to it. And I try to base it not in emotion or being angry, but here are the facts. And here's the key, Mike, for your users. Don't talk to people who haven't been vaccinated about what they should do. I'll talk about me and why I made the decision for me and my children and my mom and dad. And if you focus on why you made the decision, maybe you can find common ground that would help them bridge that gap and make the decision too.
How do we navigate people that just will refuse to get the vaccine? There will be those for either religious reasons or whatever reasons are that they're not going to get vaccinated. How do we navigate that as a society?
Yeah, I think, and let me give you a little bit of data here. It looks like about 76% of people have either been vaccinated or plan to be. That number is actually 98% in physicians. 98% of docs that you go to see have been vaccinated themselves or are planning to get it done. And so that 76% number is coming up a little bit short. With the current R0 being as high as 8, I'm now telling my listeners that we might need as many as 88% of people to get vaccinated to get to herd immunity. I know people are tired of hearing about a herd immunity, but 88% is probably the number we need. So that means half of the people that haven't been vaccinated, 12% more. So it's 24 that haven't been or don't plan to be. We need to get half of them. And we're not going to get them by beating them over the heads and telling them that they're dumb. We're going to get to them, I think, a little bit differently depending on their reason. And I'm not going to go into all 6 reasons, but I did a video this week on the top 6 reasons people aren't getting vaccinated. And some of it is just an education issue. Like, I don't know if you saw Bryson DeChambeau's interview last week. They asked him why he didn't get vaccinated. And he's supposed to be like the smartest golfer in the world. And his answer was that he didn't want to take a vaccination away from someone else that could need it more. And this is the smartest guy in the world, and I think he's being honest in his answer. He didn't feel like he had a perceived lack of access to the vaccine. And so it might be as easy as sitting down with him and explaining, no, you can go down to CVS or Walgreens or just about anywhere now and get a vaccine. So if you can overcome some of these reasons, whether it's lack of access or, afraid of government institutions, or there's all sorts of reasons people don't get vaccinated. But my strong belief is about 50% of them, with a calm, collective conversation with their doctor or someone they trust, will change their mind.
And that's I think more than anything else, the recommendation I've made to people is seek out people you trust, not just necessarily people that agree with you on everything, but people you trust and get their advice, which is one of the reasons I reached out to you, because I knew that you had gone through so much of this with getting COVID yourself and everything else. I appreciate your opinions on this, and I know that you've done your homework. If people want to learn, I know that you have a website about the rapid COVID test. If people want to get tested, they can get tested with you guys, right?
Yeah, and I think I think testing is a big part of this, but I think it's actually taking a slight back seat to vaccines right now. Like, people have asked me to talk about 3 or 4 things. How much should we test? How much should we wear masks? How much should we get vaccines? And I always start the conversation, which is vaccinate, vaccinate, vaccinate. Let's talk about that first and foremost. If we get vaccinated, we're going to get out of this. But testing is important too. And so I do think if you have symptoms and you're not sure and you're on the fence, get tested, because the sooner you can kind of isolate and quarantine, it's the same science we had in the beginning. That's going to stop the spread of this. One
of the good things today in the numbers that just came out from the Department of Health Services is that there were just under 29,000 vaccinations yesterday recorded. So the numbers seem to be climbing in vaccinations again, and that sounds like a good thing.
I think we're making an impact. Unfortunately, it was almost 3,000 cases yesterday also, but I saw that vaccination number as well, and I do think that the message is getting out. For me, one of the questions you asked me when we were prepping for this was, how did I make my own decision, right?
Yeah.
And I just have to say, as a physician, when I was in New York, watching patients die and talking to their family members, I still don't think everyone fully understands how horrific this disease is. And so when I left New York, I wanted to do every single thing I possibly could to keep family members from having their loved ones die in an ICU while they were isolated at home. It's the worst experience ever, holding a phone on FaceTime so a loved one can watch their family member die. And so when I left, I said, I'm going to do everything I can to stop those deaths. And when I started researching the treatments, whether it's hydroxychloroquine or ivermectin or, plasma, the only one that has 99% reduction in your chance of death is these vaccines, and that is held up now over 6 months. So I made the decision based on my own experiences, looking at the data and trying to save lives.
Dr. Lynch, as always, it's great talking to you, and I look forward to seeing you.
Thank you so much. Bye, Mike.
All right, thanks. That's Dr. Paul Lynch, CEO of Arizona Pain, and doing a lot of good work. I just wanted you to hear another voice on this. We had doctors on that were in favor of mask mandates. Dr. Lynch promoting the vaccine and why he did it, and a pretty harrowing story about what he saw in New York.